The English Nurse by Professor Charles Lane Olmsted. Chapter 5, Doctor Visit. A Gimcheon University presentation. Vocabulary. Constipation, constipation. Concussion, concussion. Symptoms, symptoms. Pain index, pain index. Stomachache, stomach ache. Scale, scale. And pictured is thermometer, thermometer. Vital signs, vital signs. Respiration, respiration. Pulse, pulse. Tongue depressor, tongue depressor. Temperature, temperature. Chart, chart. Pictured X-ray, X-ray. Height, height. Weight, weight. Fever, fever. Body mass index, body mass index. Rash, rash. Blood panel, blood panel. And pictured headache, headache. Dizzy, dizzy. Diarrhea, diarrhea. Nausea, nausea. Family history, family history. Medical history, medical history. Urine, urine. Pictured blood pressure, blood pressure. On the left, MRI, MRI. Stethoscope, stethoscope. Prefixes, suffixes, and abbreviations. A or ab is not or without. Asymptomatic, without symptoms. Adeno or adene denotes gland or glandular. Adenocarcinoma, cancers that start in glandular tissue. Abdomina, relating to the abdomen, space between thorax and pelvis. Thorax, thorax, pertaining to the upper chest. Thorax, space between neck and abdomen. Agra, agra, sudden onslaught of acute pain. Cephalagra, severe headache. Algia, pain or painful condition. Myalgia, muscle pain. Rear, discharge or flow. Diarrhea, frequent bowel discharge in liquid. Tomy, indicates cutting or operation. Gastrotomy, incision into the abdomen. Okay. And abbreviations. BP, blood pressure. Pressure of circulating blood against walls of blood vessels. CBC, complete blood count. Blood test that evaluates overall health and detects number of disorders. Sentence patterns. Nurse, please order a CT scan on Mr. Kim. Nurse, please order an X-ray on Mr. Kim. Nurse, please order an MRI on Mr. Kim. The patient in room 21 needs a blood panel. The patient in room 21 needs a stool sample. The patient in room 21 needs a urine sample. Nurse, I have a stomach ache. Nurse, I have constipation. Nurse, I have nausea. Nurse, I have diarrhea. I still need to get the blood pressure on the patient. I still need to get the pulse on the patient. I still need to get the respiration on the patient. When did the dizzy feeling start? When did the fever start? When did the rash start? When did the headache start? Blood pressure stages. Okay. Normal. Okay. It's under 120 and under 80. Okay. So the top number is the systolic. The bottom number is the diastolic. Okay. Elevated. Systolic is 120 to 129. Okay. And the diastolic would be under 80. High BP, stage 1. Systolic 130 to 139. Or diastolic 80 to 89. Okay. And so stage 2 would be 140 over or higher for the systolic, or 90 or higher on the diastolic. And then hypertensive crisis, systolic higher than 180, and or the diastolic higher than 120. Sentences. The nurse will get your vital signs, then the doctor will be in to see you. His respiration is very shallow, like he is about to faint. His resting pulse is in the 40s because he is a runner. His weight is ideal for his height, but he is still out of shape. 50% of the people who have coronavirus don't have a fever. And 30% of the people with the virus have no symptoms. Checking your temperature now is so much cleaner than 20 years ago. Half of my medical history is heart problems, and the other half is Alzheimer's. I had some nausea and diarrhea after I got vaccinated, but it's okay now. The tongue depressor at the doctor's office reminds me of popsicles. I hope this scale is accurate because it says I have lost 5 kilograms. Have you noticed anything different in your urine? Maybe a little orange or light red. This chart shows you have lost 10 kilograms in the last 6 months. How do you feel? This new medicine either gives me constipation or diarrhea. I got hit in the head with a baseball, so they need to check for a concussion because I was so dizzy. I put this headache off the pain index chart. The baby had a rash from the heat and wet diaper. My girlfriend's cooking gives me a stomach ache, so we eat out a lot. The blood panel usually checks for 8 conditions. I like checking blood pressure the old-fashioned way with a stethoscope. I like that they have an open-ended MRI now instead of the tube. They x-rayed my brother's head, but it didn't show anything. Even bars have thermometers to check for a fever with the virus. Medical history is a subset of family history because it is more about the individual. A body mass index or BMI over 30 is not good for you. Blood pressure stages. Hello, my name is Minji. I will be taking your vital signs today. Will it hurt? Oh no, it's just 4 things. Your blood pressure, pulse rate, respiration, and temperature. Just sit here and relax and don't cross your legs. Why? That can raise your blood pressure. Because it doesn't have a straight shot to the top? Basically, yes. Open your mouth and let me put this under your tongue. Good. Your respiration level is 18, your pulse is 72, and your temperature is 36.5. Already? That was easy. Are those normal? Yes. Let me put this blood pressure cuff on you. This will squeeze your arm some, but don't worry. Well, how was that? Situation A. Your blood pressure is 116/78. Normal range. Very good. Excellent. Is that it? That's all for me. If you have a healthy lifestyle, keep doing that. The doctor will see you soon. Situation B. Your blood pressure is 136/86. It's stage 1 high. Is that good? You need to get a healthy lifestyle and you need to talk to the doctor about medicine. You need to exercise and eat healthy. Do you smoke? Sometimes. You need to stop and you need to lose weight. C. Your blood pressure is 128/78. It's a little elevated, but not bad. Should I worry? Just keep track of it, and if it goes up more, come see the doctor. Anything else? Do you exercise? Not really. I would just walk for 30 minutes a day, a few times a week. You need to have a healthy lifestyle. You can talk to the doctor more. Part D. Your blood pressure is 204/106. You need to see the doctor. About what? Your blood pressure is dangerously high, and your pulse rate and respiration are high too. How do you feel? Fine, normal. High blood pressure is called the silent killer. It can lead to a heart attack or stroke without warning. Extra. Practice with a partner, giving different blood pressure numbers with the proper level. Then switch. Conversation B. When a person visits a doctor's office, a nurse will normally take a patient history, asking about what the person is feeling now and what problems he has had in the past, along with his family's problems. Get a partner and ask questions, then switch. Nurse and Sunju, I will ask you questions for your medical history. If you are not sure, please take a good guess, but let me know if you are not sure of something. Do you or anyone in your family suffer from diabetes? No. Do you or anyone in your family have heart disease? My mother died from it when she was 44. What did she die of? Heart attack, 5 years ago. It was very sudden. Did she have high blood pressure? I don't know. Did she take any medicine? No, she didn't take any medicine. Did she smoke or was she overweight? She had stopped smoking about 6 months before she died. Do you smoke? Nope, never did. Questions. What did Sunju's mother die of? Why is it important to know these things? What other questions could the nurse ask? Conversation C. Hello, Mr. Kim. What kind of problem do you have today? I was coughing most of the night, and I feel hot. Okay, when did this start? Yesterday morning. Do you have a sore throat or muscle ache? Some sore throat, but no muscle soreness. You have a slight fever, 38.1. Nothing bad, but just enough to make you feel uncomfortable. When you were coughing, did you cough up any yellow or green substance? Sometimes it was dark yellow. Did you take any kind of medicine or cough syrup? I took an aspirin yesterday for the sore throat and some cough medicine last night. I'm going to take a blood sample, but from the sound of it, you just have the flu. You need to take this medicine for 4 days. You will probably feel better in 2 days, but make sure you take all of it as prescribed. If it doesn't clear up in 4 days, call me back. Are you allergic to any medication? No, sir, doctor. Just take these 2 pills when you get home, 2 before bed, and then 2 more each morning. Questions. What problems does Mr. Kim have? Does he have a high fever? What does the doctor think he has?